Hello, my name is Deidre White, and I'm a freshman at SAU Magnolia, and this is my video presentation for my long paper number 2 for English Comp 1. And my topic of discussion, my thesis basically was healthcare should be free and accessible. That was pretty much my thesis statement. And the assignment was basically to write a paper, and I'm just here to give my long paper number 2 presentation. A little bit of background on why I chose this topic is because it's a little personal for me. My mother was going through some situations where she did not have insurance, so that limited her access to healthcare. And so she had some serious cardiac issues going on. So she could not get the care that she needed, so we had to go to other facilities outside of our local community. We live in a rural area in southeast Arkansas, and so we had to go to another area to seek treatment and the treatment that she needed. Her insurance, not insurance, she did not have insurance, so her medical expenses were roughly more than $5,000 for an inpatient stay. It was closer to $8,000. It wasn't so close. That was just for the hospital portion, hospital emergency portion. That does not include the doctor's fee, the radiologist's fee, anybody else who played a part in my mother's healthcare, and her medications. We had to pay those out of pocket. So this was kind of personal to me, and why health insurance and why we should have more access to healthcare, and why we as Americans should not have to worry about our health, or actually accessing healthcare or receiving the medical treatment that we need. So that's pretty much why I chose this topic. So I pretty much gave you my thesis statement about why I chose this and what my thesis statement was. 3 pieces of evidence. As I was doing my research, I went to the Health and Human Services.gov website, and I found where there was a actually study done, I think it was in 2017, regarding rural health and our accessibility to health care and our premiums, how when we live in a rural area compared to metro area, we in rural area pay a lot more for healthcare, even though we don't have nearly as much accessibility to healthcare. Our premiums are higher because there is no negotiation between the insurance company. There's limited negotiation. I would say no, there is limited negotiations between the provider and the insurance company as far as our rates that we pay versus a metro area, because there is competition. We only have one local hospital here and one local clinic, and then there is an outpatient clinic within the hospital that has one physician and one nurse practitioner. So there is no competition. We really can't compete for rates. So in the rural area of Americas, our cost for healthcare is a lot higher. Our fee schedule is higher versus someone who lives in a more metro area. So that's one of the pieces of evidence that I actually found that actually came from the Health and Human Services.gov website about rural health. Also, I found another piece of evidence also from ahrq.gov, meps.ahrq.gov, where it actually stated that in 2017, the premiums were projected to increase in 2018 to 3% for a single individual. So again, that's another piece of evidence I found actually on the government website. And then pretty much all my research came from a .gov site. So also, the next thing is provide one surprising element that you learned about the topic during your course of research. Well, that was really the surprising thing, how we in rural America how we pay more for healthcare than our metro counterparts, because studies show that we don't have access to a lot of things as far as wellness, or we don't, it's not that we don't have access, we have limited access compared to high, as far as the mortality rate is higher. um, um, we're more obese, living in rural areas. We don't get out and exercise more. These are studies that have been found on the .gov websites that I mentioned earlier, and that was kind of shocking to me. About, it shouldn't have been, but it was, considering I've worked in healthcare. But it was shocking. That's one of the things that I did find out, and how, and I wasn't too surprised about how people with no insurance, mortality rate is higher versus those with health insurance. So one of the challenges that I faced during this process of writing this paper was my introduction paragraph. That was the one thing. Even though I knew what I wanted to write about, I I researched what I wanted to write about. However, it was my introduction paragraph was a little difficult, and actually putting my thoughts on paper was a little, typing my thoughts out was a little difficult, and trying to actually organize them in a way they didn't sound all over the place, pretty much. That was the most difficult thing for me. I don't know about anybody else, but to sit down and organize your thoughts and actually type your thoughts out, that was the most challenging part for me. But I will say it was a good experience for me. And typing out 1,250 words, that was challenging as well. It was a good experience for me. It was a new learning experience for me. I'm actually glad I got to research this topic. And, it makes me appreciate what I do have, and the things that are to come. So, yeah, that's about it. Thank you.